Hello, professionals. This is Dr. Saad, and as you know, we are recording series of lecture for pharmacists who are going to appear for international equivalency exam. Recently, we concluded endocrine system and with the reference of pharmacology, and now we are going to talk about its clinical aspect, where we will discuss about its various clinical deviations. That deviations are thyroid and parathyroid disorder, diabetes mellitus, menstrual cycle disorder, menopause, rheumatoid arthritis, as well as osteoarthritis. We will see how group of drugs can be used to manage the situation in various aspects and what are their signs and symptoms. These are our main focus even in clinical recording of this system. So without wasting more time, let's move on our topic, that is the thyroid and parathyroid disorder. And as you know, we'll talk about first of all thyroid gland. It has two abnormalities, that is the hyperthyroidism and hypothyroidism. Let's begin from the hypothyroidism. First of all, its sign and symptom. At skin and appendages, hypothyroidism patients show following signs and symptoms. That is the dry skin, cool flanking and thickened skins, reduced sweating, yellowish complexion, puffy face and eyes, and coarse dry hairs as well as brittle nails. Similarly, at neuromuscular system, that patient show slow speed, poor memory, reduced cognitive functioning, somnolence, corpus tunnel syndrome, psychiatric disturbances, hearing loss, and depression, muscle pain, weakness, delayed deep tender reflexes. Similarly, at metabolic disabnormalities, raised total cholesterol as well as LDL cholesterol, and macrocytic anemia will be visible. At gastrointestinal tract, weight gain with decreased appetite and abdominal disturbances, ascites, and constipation will be visible. At cardiovascular system, drop in cardiac output, bradycardia, cardiac enlargement will be prominent signs and symptoms of hypothyroidism. Keeping in mind that mixed edema is a rare but potential fatal complication of a severe untreated hypothyroidism. So these are the signs and symptoms of hypothyroidism patient. So we'll see how we will treat this patient. Thyroxine is a treatment of choice except in the case of mixed edema, where we will choose triiodothyroid, or you can say T3 drugs, to address the situation. As I told you that T3 drug is more potent than that of T4, and T4 peripherally metabolized to the T3 to perform the function of thyroid gland, thyroid hormone. So T4 is a drug of choice, but in case of mixed edema, we will choose T3. Remember, calcium proton pump inhibitors, iron, and antibiotics. These drugs should be used separately with levothyroxine tablet because it has an interaction, so it will ultimately affect the uh, efficacy of levothyroxine. Point number 3 in prescription is that during pregnancy, 25 to 50% increased dose is required to maintain the thyroid stimulating hormone in trimester specific reference range. So keeping in mind that 25 to 50% dose will be required to increase in case of pregnancy. But remember, bone density is reduced in T4 excessive user. So be careful while prescribing. Neither prescribe less than requirement nor prescribe more than requirement. So because to avoid from the adverse effects. Next topic is the hypoparathyroidism, or also known as thyrotoxicosis. The same situation is about its. First of all, we'll discuss about its sign and symptom. Let's see. At skin, hypothyroidism will show following signs and symptoms. That is the warm and moist skin, thinning and loss of hairs, and increase sweating and heat intolerance. Similarly, at nervous system, hyperthyroidism patient will show following signs, that is the insomnia, irritability, nervousness, lid retraction, staring eyes, symptom of anxiety and psychosis. These symptoms will be visible at nervous system. At muscular system, fine motor tremor and proximal muscle weakness and rapid deep tenderness reflexes as well as osteoporosis will be visible for hyperthyroidism patient. Similarly, at gastrointestinal tract, patient will show weight loss despite increase in appetite, thirst, as well as diarrhea. At cardiovascular system, palpitation, tachycardia, shortness of breath, atrial fibrillation, cognitive heart failure, congestive heart failure, and worsening angina. These signs will be visible of hypothyroid. These are the signs and symptoms of hypothyroidism. Its management strategies. Number one, we'll use thionamides. Thionamide will require at least 6 weeks after starting treatment, and the example of that 6 weeks will be required to maintain the normal level of thyroid hormone, that is also known as euthyroid stage. So, thionamide examples are carbimazole and propylthiouracil. Carbimazole will be recommended 40 mg once daily. Similarly, propylthiouracil will be recommended 150 mg 2 times per day. Second option is the radioiodide. Third option is the surgery. But remember, during pregnancy, surgery treatment plan will be deferred. Next is about the immediate treatment strategy for thyrotoxicosis. We will use non-selective beta blocker in standard antihypertensive dose, and you just keep in your mind that these drugs will affect within a matter of hours, but these drugs shouldn't be used, or beta blocker shouldn't be used to all non shouldn't be used in a patient who is asthmatic. All non-asthmatic patient, this drug should be used specifically in case of thyrotoxicosis, because it will control the treatment within the matter of hour. Graves' disease is also the part of this hyperthyroidism disease, and in this we have the option, that is the surgery as well as radio iodide thyroid ablation therapy. Keep in your mind that, as I told you, the thionamide implication, in which carbimazole dose can be used from 40 mg to 60 mg, but each dose would be used of multiple of 20 mg. We can't give 40 mg directly or 60 mg directly. You have to use multiple of 20 mg doses. Similarly, side by side, you have to recommend the thyroid replacement therapy to maintain normal homeostasis of body. Lowest dose of carbimazole and propylthiouracil is recommended in case of pregnancy, and fetus monitoring would be required, because as we are going to defer the treatment of option of surgery during the period of pregnancy, so we will maintain that patient by the use of thionamides. But fetus monitoring is mandatory for that patient. Next option is the thyroid ablation therapy. It has following guidelines, that is we will use radioactive iodides, and a patient, Graves' disease patient, has following risk, that is if you use thyroid ablation therapy and radioactive iodide in the Graves' disease patient, it has the risk of ophthalmopathy. This ophthalmopathy is managed by the use of prednisolone with a dose of 0.5 mg per kg for 3 weeks. Similarly, we will use thyroxine 3 weeks after radioactive iodide. Remember one thing more in your mind, that after thyroid ablation therapy, lifelong thyroxine dose will be required to maintain normal homeostasis of our body. Similarly, in case of severe thyrotoxicosis, restart antithyroidal drug treatment on the day third, as during thyroid ablation therapy we blocks this treatment for short period of time, but in a case of severe thyrotoxicosis, we will restart antithyroidal drug on the day 3, and we will gradually or periodically withdraw this drug. We will use Lugos solution, iodine, beta blockers as an antithyroidal drug options, and these drugs, beta blocker, iodine, and Lugos solution, will be required in the in the planning of thyroid ablation therapy. So these are some points which was linked with the thyroid ablation therapy that must need to be kept in mind. So it was just highlights which require further explanation, and once we will record another series for medical students, and then we will talk about in a detail that, and we will explore all these points. But this segment is specifically linked with the pharmacists who are going to prepare for international equivalency exam. So relevant hints would be sufficient for them to recall their previous knowledge. So this was all about the hyperthyroidism and its management and all relevant points. Next deviation or clinical aspect of endocrine system is the hypoparathyroidism and hyperparathyroidism. As first of all, we talk about the hypoparathyroidism, or also known as hypocalcemia. Its signs and symptoms. Sign and symptom of hypocalcemia or hypoparathyroidism are following. That is the numbness, tingling, muscle spasm, epilepsy, irritability, cataract, facial spasm, and spasm of hand. What are the causes of hypoparathyroidism? Its causes are hypoparathyroidism or pseudo hypoparathyroidism, vitamin D deficiency, acute or chronic renal failure, hypomagnesemia, and acute you can say drug induced acute pancreatitis. These are the causes of hypoparathyroidism. Its treatment option or management strategy is the administration of alpha calcidiol. Alpha calcidiol is its restore its level within 1 week, and the dose of alpha calcidiol would be used from the range of zero point 0.5 to 1 mcg per day. So this is the administration management strategy for the hypothyroidism, which is also known hypoparathyroidism, which is also known as hypocalcemia. We'll use alpha calcidiol with a dose of zero point 0.5 to 1 mcg. This strategy will restore normal level of calcium, restore the normal hypothyroidism, normal parathyroid hormone functioning within the matter of 1 week. Next is the hyperparathyroidism. I was talking about the hyperparathyroidism, so let's discuss its sign and symptoms. That is the anorexia, weight loss, polydipsia, polyuria, mental changes, poor concentration, memory, and fatigue, nausea, dyspepsia, and vomiting, constipation, hypertension, renal stone, and bone pain and deformation, and pathophysiological fractures. These are the signs and symptoms of hyperparathyroidism. So its treatment or management strategy, that is the first of all, we'll talk about the options. That is the surgical removal of adenoma and all hyperplasic tissues. Number 2 is about the vitamin D replacement therapy. And number 3 is we will use parenteral biphosphonate, that is the pimidronate. Example is the pimidronate. We will use 60 to 90 mg into 50 ml of normal saline over the period of 60 to 90 minutes, and this will normalize hypercalcemia in the duration of 72 hours in most cases. But keep in your mind that a person who went through a surgical procedure for the treatment option of hyperparathyroidism, 10% out of them will permanently face the problem of hyperparathyroidism. This is a drawback of surgical administration or approach of the management of hyperparathyroidism. Side by side, we use the vitamin D as well as biphosphonate parenteral administration. That example I have told you, its option is the pimidronate. So this is the treatment for the hyperparathyroidism. Our topic of thyroid parathyroid disorder ends here. Now we will begin next abnormality that is linked with the endocrine system. It is the diabetes mellitus. We'll talk about first of all is about its sign and symptoms. That is the polyuria, polyphagia, fatigue, polydipsia. And as I told you about the fatigue due to the inadequate utilization of glucose, marked weight loss because of dehydration and breakdown of body protein and fat because of the alternative energy source. These are the signs and symptoms of diabetes mellitus. Main diagnosis: we will use blood glucose parameter as a key factor for its diagnosis. For that, we will perform our blood glucose test in fasting fed stage, and we will use HbA1c level as a key for the diagnosis of diabetes mellitus. Let me tell you about its ranges in normal, pre-diabetic, and diabetic patient, just for record. A normal patient blood glucose level in case of fasting will be below 100. So I will talk about in milligram per deciliter range, not in term of millimole. So just keep in your mind that 3.9 millimole is equivalent to the 70 mg per deciliter. So you can easily convert this value if you required in case of millimole. So I will talk about in the unit of milligram per decimeter. So in a normal person, in a fasting stage, its blood glucose level will be below 100. In fed state, its blood glucose level will be below 140, and HbA1c of a normal person will be below 5.7. Similarly, in pre-diabetic patient, in fasting state, blood glucose level will be within the range of 100 to 125, and in fed state, its level will be between the range of 140 to 199, and its HbA1c level would be between 5.7 to 6.4 of pre-diabetic patient. Similarly, once diabetes is established, so blood glucose level in diabetic case, in fasting stage, it will be 126 or above in fasting stage. In fed stage of diabetic patient, blood glucose level would be above 200 and its HbA1c level would be above 6.5. So sign and symptom as well as HbA1c and blood glucose monitoring will act as a key factor for diagnosis of diabetes mellitus. So there are some situation that is known as diabetic emergency, which is also known as hypoglycemia, glycemic risk, and it is in this seizure, coma, death are one of the common threatening effects. So diabetic emergency is one of the problem while managing or treating the patient of diabetes mellitus. But remember that 1 or 2 daytime mild episode of hypoglycemia of each week is a common with all diabetic patient. But hypoglycemia that leads toward a diabetic emergency is a very serious condition which need to be very carefully management or monitoring. Second is the diabetic ketoacidosis, that is known as the fluid and electrolyte restoration, that will be managed by the use of fluid and electrolyte restoration, that is the 0.5% normal saline and insulin replacement therapy with the dose of zero point 0.1 unit per kg per hour. These two option will be used for management of diabetic ketoacidosis, which is also a very potential condition. Next is about the long-term diabetic complication, that is the macrovascular diseases, and that includes cardiovascular diseases and nephropathy and peripheral nephropathy. Similarly, macro and microvascular disease, that is known as diabetic foot problems. These are the complication that is associated with the diabetes mellitus. Microvascular complication, diabetic ketoacidosis, diabetic emergencies. These are the conditions which causes a very serious effect on patient's life if glycemic control is not kept under a strict monitoring or under a proper regime. So now we'll talk about its treatment option. And first option is the structural educational program. In this, first of all, low dose or low glycemic index carbohydrate is recommended. Alcohol may cause hyperglycemia, so it need to be avoided. Third, fat should be less than 35% of total energy intake. Protein intake is recommended, and fiber has useful properties in diabetes in glycemic control. Salt restriction to avoid the CVS risk, and obesity management, and it must be required if a patient's BMI is above 28, then orlistat is recommended to help that patient to control the BMI in the normal range. And HbA1c level, or you can say target of HbA1c for a diabetic patient is 6.5, and that should be our center of management strategy for the diabetic patient. Its HbA level should be remain at 6.5. So this was all about the structural education program. Next is the pharmacological intervention. That is the first of all, we talk about the insulin, and it has various preparations. That is the fast acting, or you can say immediate acting insulin. That is known as recommended immediate before meal, and its examples are insulin lispro, aspart, and glulicine. And then next is the intermediate acting. Its example is the NPH or zinc with zinc with lentic insulin, and it is recommended twice daily administration to adequately cover 24-hour period. Similarly, the third type is the long-acting insulin. Its example are the glargine, Detmir, and degludec. These are the example of long-acting insulins. So regime of insulin administration would be that 2 to 5 injection daily would be sufficient to control the patient. But keep one thing in mind, that newly diagnosed type 1 patient should be offered multiple daily injections until we arrive at a conclusion or a proper formula with respect to the patient's requirement. And then we can say we will come back our normal regime, that is the 2 to 5 injection per day for the management of the glycemic blood glucose level. But for a newly diagnosed patient, multiple injections required. 30 minutes before breakfast or 30 minutes before evening meal, these are the strategies that has to be these are the general rule for the management, for the administration of intermediate acting insulin. That is the 30 minutes before breakfast and 30 minutes before evening meal. Next point is about the storage. An element of prescription is the storage of insulin. It, according to a research, 5 to 10% loss of potency occur in vial if it is kept at the room temperatures for 2 to 3 months. So its storage condition must be need to control, as it can lose the efficacy of insulin. Next is this is was all about the type 1. First, we talk about the structural education program that was for both type 1 and type 2 diabetes mellitus, and insulin administration and its regime planning, that was in which we talk about the fast acting, immediate acting, and rapid acting. Fast acting, intermediate acting, and long term acting insulin, that was about particularly for type 2 patient, type 1 diabetic patient. And now we'll see how we will manage type 2 diabetic patient. Type 2 diabetic patient, 85% are overweight. According to a research, 85% type 2 diabetic patients are considered as overweight. Their BMI need to be maintained between the range of 20 to 25, and their you can say wrist circumference must be maintained. For men, that is recommended is 102 centimeter, and for women it is recommended to maintain within 88 centimeter. That is the first approach, that is non-pharmacological target for management of this type 2 diabetic patient, to reduce the obesity, to maintain the BMI, to maintain the risk circumference of men and women according to the standard, as I told you. Keep in your mind that stress causes hypercalcemia, so try to stay patient or diabetic patient away from stress because it causes hyperglycemia. Now let's talk about the medicine. It's as we have already talked about in pharmacological section in its detail, and we have already informed you about the doses separately for each class. So here I will just give you a review. First is the biguanoids. Its example is the metformin. It has a side effect of lactoacidosis complication. As I told you, the metformin is recommended 500 mg BD, and weekly interval you can increase its dose, and maximum dose which beyond which you can take it, that is the 3 gram per day. Next is the sulfonylurea, that its side effect is weight gain, and it can also cause hypoglycemia. Next is the meglitinides. Its dose is 500 mcg before each meal, and maximum 4 milligram dose can be recommended. And next is the example is the natiglinide. Its dose is 60 mg 3 times per day to 120 mg 3 times per day. Next is about the classes known as thiazolidinedione. Its example is the pioglitazone. Its dose is from 15 to 30 mg or 40, 45. Even we can also recommend 45 mg per day. And its side effect is also weight gain. Similarly, next is the sodium glucose co-transporter inhibitor and DPP4 inhibitor, and incretin mimetics, whose examples are liraglutide, dulaglutide, and lasixantide. Are used. These incretin mimetics are used subcutaneous injection form, and next is the insulin therapy and alpha glucosidase inhibitor. These are all options which have already been discussed in the previous pharmacological sections. Just for the review, I mentioned it here again. It is used for the management of type 2 diabetes mellitus. Keep one thing in mind: the target blood pressure for diabetic patient is 140 by 80 mmHg. But if this patient is affected by eye, kidney, or serious damage, then the target of blood glucose control, sorry, blood pressure control will be changed. Like for diabetic patient, target was 140 by 80 mmHg, but for a patient who is suffering from eye, kidney, or serious damage, its target is 130 to 80 mmHg. So I think so video is going too long, and remaining abnormality of endocrine system will be discussed in next video. Thank you so much, and if you feel that this effort is helpful for you, then please subscribe our channel.